No, I would think with HIV, one of something I've noticed, especially in Catholic countries, is there's a little bit of an aversion towards sex education
Yes.
as well as birth control usage,
Yeah.
and specifically condom usage, and HIV. Something that I've noticed, at least, is that it is prominent in the gay community, but also because of the stigmatization of homosexuality, men that are married still go out and have gay sex, usually unprotected, and they don't tell their wives, and they come home and they give it to their wives, who have no idea that their husbands are off engaging in homosexual acts. Not to say that I disagree with that action, but it's something that tends to happen.
A lot of stories like that. But to answer the question about, I mean, in regards to the Catholic community, I think the social media is helping. I mean, people are more now open to talk about sex and to talk about how to prevent HIV. There's a lot of organizations taking care of the knowledge or public awareness about it. But I don't know, because sometimes even if they know, even if they are not aware, I don't know. It's very, some people are really hard to control. You cannot,
I knew I should have done it with a condom, but I didn't.
Yeah, but you cannot put the CCTV on every Filipinos,
No, most
But
definitely.
in terms of the Catholic, Catholic being our religion, and the sex education, I think we are being more open because of the social media.
Social media, as well as
It helps.
international communication with other
Yes,
cultures, is
yes.
allowing for the
Yes.
information to disseminate amongst the
Yeah,
people.
that saying that condom is acceptable. I think condom is acceptable right now. You can see condoms everywhere. I mean, every
Oh, I
convenience
see them
store.
at all 7-Elevens. They're
Yeah.
right there for me.
Yeah.
Never being used by me, but they're right there.
For the other type, which is non-communicable, these are also known as the lifestyle or chronic diseases, like the cardiovascular. This is preventable, especially if you do the proper diet and exercise. This is
10
very
minutes of exercise a day.
this is
can
very
help.
old advice to proper diet and exercise. So I think it's still the old. Still the old ways. You just need to eat the right food and do exercise. And if you feel you don't need to feel some negative. You don't need to feel symptoms before you go to doctors.
Right.
You should have like annual checkup, especially if you're already like in your adult age.
Now, what age would you say is the adult age?
Technically, if you're more than 19.
That's right, guys. If you guys are 20 or above, yearly checkups.
Yeah, but I think maybe 30 years old and above. Because of course 20 usually they're still active in terms of their activities, but when you reach 30, like my age, the sedentary lifestyle, and still the annual, and I also should tell it to myself.
Yeah, I know, right? We give great advice. Do we take it?
The annual checkup. And of course, if you have the history of stroke, if you have the history of diabetes, better check.
So check with your family about what is your medical history in your family, because knowing what kills your relatives might save you from suffering the same
Yeah,
fate.
usually 30 years old and above, it's the onset of those kind of diseases.
Right, and if you go for a yearly checkup, you're much more likely to catch something before it becomes, 1, more expensive, 2, death.
Yeah, because of course you have to remember, hypertension and diabetes are very controllable diseases.
Right.
If we take the medicines, if we will be religiously following the doctor's order or recommendation, it will it will be like you will live a normal life, And aside from those two, of course, cancer. I have a lot of relatives who died of cancer. Also,
Mine too.
no, that's also the problem. Like for example, I have a neighbor who has breast cancer. You know, breast cancer, if we catch it early, it's curable.
Right.
It's curable. But I don't know, some, they really, maybe because of fear or because of lack of knowledge, they will just go to the clinic if they have this humongous
Right,
mass.
they're not doing the monthly breast exam that you're
Sometimes
supposed to
they
start
do.
doing.
Sometimes they do. They already
But they
palpated it, but they just ignore.
oh, breast exam. Oh, that's not good. I'll just ignore it.
Yeah, most of
I'll just wait for it to get worse.
yeah, I don't know why. Most of patients are like that, but just to emphasize, breast cancer is curable if it is not just breast cancer, most of the cancer. Hence, some of the cancer some of the patients that are cured from cancer are those doing the annual checkup because
Right.
for example, lung cancer, they incidentally see something in the X-ray and they go to the pulmonary doctor and then do biopsy and they will learn it's really cancer. They just need to cut it off.
Cut it out. And when you catch it right away,
Yeah.
it can't spread to everything and
Yeah.
become a big black mass of death.
Yeah.
That's a big problem.
The cancer will eat you up.
Right. So preventative. It sounds to me like preventative healthcare is some. And if you do it annually, it's going to be much less expensive.
Yeah, and then of course healthy lifestyle.
Mhm.
Our focus most of the time is on the smoker, but we are also forgetting that secondhand smoke can also cause cancer. Being a secondhand smoke, for example, your father is smoking and you're right there. It's like also you're smoking.
Or you're in a jeepney and all that diesel air
Yeah,
is blowing
exactly.
right in your face.
And
The
we're
mask's up.
yeah, just to share with you, our company Clearbridge Health Philippines, we're also offering genetic testing. So if there's a cancer that runs in the family and you want to know if you have the same risk of having cancer, using your saliva, we will know if there's any DNA change. And because if there's DNA change, there's an increased risk.
Right.
And then, of course, if you are noted to have mutation or gene changes, we have three options. There's hope. One is we can again, this three step will depend on the gene that is mutated because there are some genes when mutated can cause aggressive cancer. There are some very slow growing cancer. So we have for slow growing cancer or the genes that can cause slow growing cancer when mutated, we have the option is to increase the frequency of checkup.
Right.
Make it 3 months like that. Second, if the gene is when mutated, known to cause aggressive, we can do preventive surgery. Or third, we can take some chemopreventive drugs. These are drugs that can prevent cancer.
Right.
But this one, you have to consult oncologist so to give you prescription. So when you do this test, we actually have complimentary genetic counseling being done by US certified genetic counselors.
Oh, wonderful.
Because again, one of the challenge why we're having difficulty introducing this genomic medicine because we have less genetic counselors. Most of our genetic counselor or genetic expert are more inclined to inborn metabolism error, more of the babies like the problem in the chromosome and some genes related to the babies and young people. But as per the cancer, we only have less. We don't have much experts on that. That's why I really did pursue this to start the awareness because this is not just a job for me being the medical director of this company, but I think this is an advocacy. That's why my company, we go to different areas in the Philippines, different provinces, to speak about what's the advantage of genomic medicine, how will it prevent cancer, how will it help oncologists or surgeon manage people with cancer. So it's really an advocacy for me. So even if I'm really tired, thinking that I will help a lot of people, I'm helping a lot of doctors because not all doctors. This is not hardly taught. There's no subject about genomic medicine as of now in med school. There's only a touch of it,
So you're like your frontiersmen here in the.
I think that's
in the new
I
world,
consider
genomic
myself
medicine.
as one of the pioneers. That is why I consider it as advocacy for me because it's like teaching the entire Philippines what's genomics.
You got 100
genomic
million
medicine is.
people to educate.
Yeah.
You better start
Yeah.
working. Well,
Yeah.
we're working on this video.